Welcome to Design to Thrive, the podcast where we explore how bold companies use tech to grow smarter and serve better. Today, we're joined by Hemant Shah, CEO of BaltoRx, a rising startup redefining prescription delivery with innovations like real-time tracking and pharmacist video chats. We'll dig into their journey, challenges, and where AI fits into the future. Let's dive in.
Hello, everybody. My name is Ngoc. This is Design to Thrive podcast. We have a guest on the show. His name is Hemant. He's from LA, California, and he's here to share a story with BaltoRx. So, hey, Hemant, welcome.
Thank you.
So, beginning of this call, let's dive deep into the story behind BaltoRx. So, can you explain how BaltoRx all started, the origin story?
Yeah, sure. The BaltoRx, we were on a dinner table one night and we were discussing after the pandemic that, hey, everything is being delivered. Why medicines are not being delivered, right? So based on that thought, I put the whole, idea together. Then I did my research on it, why the medications are not being delivered. So I did about 6 months of research, talked to many different hospital CEOs, pharmaceutical companies, pharmacists, and everybody shouted that, hey, there is a definitely need there. People are looking for medicine to be delivered because a lot of people are non-compliant in the industry and they are looking for delivery because they don't have any ways and means to go there and they have to stand in line and so many other factors affecting them to get the medicine. So that's why we put the platform together and I know the whole platform is now delivering medicine within 2 to 4 hours on the same day.
So, you are a medicine delivery business.
Yes, we are not the pharmacy. We are purely logistic company where we pick up the medicine from the local pharmacy and deliver to the patient within 2 to 4 hours on the same day.
Okay. And with BaltoRx, what are the main services that BaltoRx provides, and what challenges are you solving right now?
Well, BaltoRx is designed in the sense that if you look at the platform wise, we call it as a Balto intelligent platform where we connect all the pharmacies who are our partners, all the hospitals, either private or public, who are our partners, all the hospices who are our partners, and also the millions of patients nationwide. We are connecting on one single platform called Balto intelligent platform. And that's what the platform is designed. So that way we can really, seamlessly deliver medicine right from the request from the either patient or the pharmacy or the hospital or the hospice within the same day. That's how the platform is designed for. It's a very cohesive platform and it's a very effective in terms of getting the delivery on the same day.
Okay. And are you currently implementing AI in the prescription delivery business?
Yes, definitely. Now, AI is a new buzzword in the market, in the industries, and people are going after it crazy. And, a lot of people have anxiety about what is AI, how is going to impact a human's life, right? I mean, that's what, we have been also working on it and we are looking for the patient care, basically how we can really improve and, give like precise medical advice to the patient so they can improve their own life. I mean, so we initiated AI powered kind of a tools and we are working on it. And I came up with the three major kind of area where we can really help patient directly based on the AI. And so the number one is, when the patient gets the medications delivered, our system is going to remind them about the intake of medicines on the whatever the period that the pharmacist is suggesting. Our system is going to keep reminding them to take the medicine. So that's one of the features that we are going to integrate into our platform. The second model that, features that we are talking about is how we can provide very specific information about the patient and their well-being directly to them and based on their medical history and based on their medical prescription intake. So that way it will give them precise health information. So it is up to the patient then how, they can interact with that and give them really good idea about, what is health. I mean, just to give an example that if you go to WebMDS, for example, to get something information to get, right? I mean, it's a big ocean or any other medical site that you go. It's so many things will provide you in so many links, so many information. You get lost. It's like an ocean. So our model would give them definitely very precise information that how to use these medications and what are the implications and how it can really improve their life. And the third one is also very important feature that we are working on it. And this is called the OTC, over the counter product. And there are a lot of, vitamins and essentials, supplements, like over the counter, medicines are available. So, if somebody wants to go and pick up OTC product, they have to drive, they have to go, they have to tell somebody to get it. And chances of getting a correct one is kind of, very less likely to happen that. So, we are designing a product where the patient from their phone via either via voice or via one click, they can say, hey, I need Tylenol. And our system would find the local pharmacy where normally they go. And we will pick up the requested item and deliver to them within 2 to 4 hours. So this is something just by one voice or by one click, it can be delivered. And all these features are based on AI technology. And that's what we are focusing on now.
Well, that's genius. Hemant, as CEO of BaltoRx, what's your day-to-day role look like?
Well, I started the company and I manage it in every aspect of, the operation of the company, including engineering, including logistics, including sales, marketing. Because of course, I do have a team in place who does the work, but I'm the one who is managing on a daily basis to them. And my best goal is to provide the best care to the patient who are literally waiting for their medications to be delivered on the same day. And that's what our focus is, and that's what I'm focusing on.
Okay. Now, how do the trends like telehealth impact prescription delivery?
Well, the telehealth would be the added, kind of feature for us, because nowadays after the pandemic, telehealth is getting very popular, and even the doctors and the practitioner nurses and the hospitals, they would like to have the telemedicine kind of services to them. So what would happen? It will really help us delivering medicine to them because the patient don't have to go to the hospital or the physician's office. They can do it on the same day. Physicians can prescribe on the same hour and it can be delivered on the same day. So telehealth would be a good, really added, kind of a tool for our delivery service.
Okay, so Hemant, who are your customers?
Okay, our main customers, are all the corporate accounts and the retail businesses. What BaltoRx is offering, there are two areas, B2B and B2C. So what I'm going to focusing on B2B. So what our customers that we are looking for is all the pharmacies. There are about almost 70,000 pharmacies in the US. So we are focusing on all independent pharmacies, compounding pharmacies, closed door pharmacies, retail pharmacies, including big boxes also. So these are our main target of the pharmacy because they are the one who is dispensing the medicines on a daily basis. Now also understand that in the US, there are 6.1 billion prescriptions are written every year. 6.1 billion. And every year there is a 10% increase, steadily increase every year. So out of that, less than 1% prescriptions are being delivered at home. So look at the market. It's a very huge market out there. And the pharmacy is a vital component, the place where the medicines been dispensed. All the pharmacies are our main customer, that we are looking for. Another one is hospitals. There are, more than 5,000 hospitals, either private or public in the United States. And when the patients get discharged at the hospital, they have to give them the medications before they leave the hospital. Now, many hospitals are not equipped with the pharmacies or they don't have the medicine. So they have to depending on outside pharmacies to get the medicines delivered before the patient goes home, right? So that's the area also we are targeting to the hospitals. So the discharging patients can get the medicines before they go home. The third area, the B2B that we are targeting is hospices. There are hospices, thousands of hospices nationwide, and they have, many, many patients staying there, and they need medicine 24/7. So, and they live at the distance from the pharmacy. Not all the pharmacies are dealing with the hospice. So, we are also looking for the hospice pharmacies that we can help them to deliver medicine. Even the people are living at the distances like 50 miles, 100 miles in urban areas, rural areas, those kind of things that we are targeting. And the fourth most important is all the patients. They are nationwide, millions of patients are there, and everybody is looking to get medicine delivered. Now, nowadays the food is so common. The pizza gets delivered every single day, every single hour, right? So that's why we wanted to reach out to millions of patients, that we can tell them that we are offering these home services, that we can deliver your medicine with so many different features. So we have, for the B2B, we have web design tools that they can use it, and for the patient we have the mobile app called Deliver My RX, and anybody can download Deliver My RX from their Play Store or the App Store, and they can just sign up and then start requesting the medicines to be delivered at home. The patients also another area that we are very active onto that one. So this is what we are looking for.
Okay, perfect. And how do you use those tools to attract those kind of customers?
Yeah, so what we have done now, that a couple of models that we have designed, the modules. One is Meds on Demand. What is Meds on Demand means that we are focusing on weeknights, weekends, and the emergencies. If the pharmacy have to deliver this like after 7 o'clock when they close, right? So many pharmacies are there open till 9 o'clock, but they don't have any way to deliver that. So we are working 24/7 basically, and we do deliver weeknights, weekends, and in emergencies using Meds on Demand. And we have another tool developed just for the pharmacies, that in pick up on demand. So we can also help them pick up the product if they don't have medicines in their stock, and if they want to get it from the warehouse or get it from some other pharmacy or from somewhere else. So they can also request this through pick up on demand form, and we can deliver the medicine within 2 to 4 hours to them also. So these are the two major components that we are working for the pharmacies, and it is very, very helpful in terms of meeting their requirements to deliver medicine to their patients.
Can you go back on the point of the BaltoRx platform and video consultations? Some of the tech
Yeah,
that you integrated?
yeah, sure. So what we have done, I mean, when you go to the pharmacy and have the medications, then there is a requirement, or there is a kind of a things people need it to consult the pharmacist, right, for the medications. They know what are the side effects, what are the implications, so and so forth. There are many people have so many different questions, and the pharmacists are supposed to give you the consultation after they dispense the medications to the patient. So when it comes to the delivery aspect of it, normally people deliver, in person, or maybe we have to leave it at a certain place, right? How do you consult if you deliver? So I came up with an idea that instead of going to the pharmacy and having consultation, or calling the pharmacist and stay on the phone for how many minutes, we don't know whether the pharmacist is coming on phone or not. So we have designed a product called See a Farm, which gives the patient a direct connection to the pharmacist. After they receive the medications, they can make the video call and do the consultation. This is how the system is designed for. So each a patient, when they get the medicines delivered, our system will activate the link for them to click on it, and it will connect directly to the pharmacist for any kind of consult.
Okay. And our clients or patients and pharmacies, how are they giving you feedback on these pro features?
I think we are getting very positive feedback on it, because even the patients are very happy about it, because they don't have to dial their phone, they don't have to wait online, they don't have to go out. I mean, just once if they get the medicines there from the within the app, they can just click on it and they can just talk to the pharmacist. It's very wonderful feature. They are very, very happy about it. And of course, at the same time, the pharmacist, at the other end, the pharmacists have to have video capability, kind of features on install on their system in order to connect with the patients. They are also very happy about it.
Okay, perfect. Well, I'm glad your clients are happy. Without a happy client, you probably won't be in business, right?
Correct, correct.
So with crowdfunding and expansion on the horizon or investors, What is your vision for the next few years?
Well, my vision is to definitely give, personalized patient care after we come up with the AI kind of installation on our platform. That's one of the, mission and the vision that we have. And now because of the AI is so popular in every aspect of our life, and this will also add a lot of value to it. So if I'm looking as an investor, if they really look at it, these are the features that, we are providing personalized care to the patient. It will really increase the value of our product and the services, not just to the patient, but as the investors also. And it will really increase kind of wealth to every player on the platform.
And are you currently focusing in the States for now, or do you plan on expansion in Canada or Mexico or around the world?
Well, right now we are focusing in the US market, and we are serving right now about 10 to 10 plus different states. Major is California, New York, New Jersey, those kind of states we are serving, and we are expanding into the different states. Our ultimate goal is to also go into the Canada, once if we get any kind of funding. That is our future goal.
Okay, perfect. Now, as you expand, what systems or tech are you focusing on improving?
The entire platform, because our platform currently right now is a very seamless. And as I said earlier, that we are connecting a lot of pharmacies, hospitals, patients, physicians, everybody onto the single platform. So we just wanted to continue that seamless effort and seamless kind of feature going into the future. And after adding AI feature into it and lot more other product that we have in pipeline, that also will be a part of our platform. So we just wanted to make sure that our platform goes smooth and it does deliver seamlessly to every single day to the patients. That's what we are looking into that.
Okay. So about AI, what would be an ideal AI powered solution look like for your business right now?
AI, I mean, that is a kind of a new things in the market and in people's mind also. Even politically, if you look at it, I mean, technologically, if you look at it, the AI is everywhere, right? So we are definitely looking. AI would be kind of features that we are working on would be really valuable to the people who are involved into our platform. Means including the patients, the pharmacies, hospitals, hospices, and everyone else. So that's what we are looking into, that AI kind of offering.
Okay. And I have one last question. If you could fix one thing, one operational change, what would it be and why?
If I can really fix one good thing about it, I would like to give free services to all the patients who are looking to have their medications delivered at home.
Okay, perfect. Well, thank you, Hemant Shah, for coming on to the show. We'd love to have you on the next one. So please keep on watching these videos. Take care, man.
Thank you, Nog, for having me on, and hopefully we can do a lot more than this one too.